morning, this is Dr. Ken Starr. I wanted to talk to you a few minutes about perioperative dosing of buprenorphine. So many patients are stable on Suboxone or buprenorphine products. They have an emergent or an elective surgery or procedure coming up, and the hospital docs, surgeons, anesthesiologists can be perplexed or confused about how to manage these patients. The concern is that if someone's on buprenorphine, they can't receive full opiates for a pain control. So if you're going to have a painful procedure, historically we've stopped buprenorphine, started opiates, then patients have to try to get back on the Suboxone. That's a real risk of relapse for the patient. So the recommendations now that says that if you're on 8 milligrams of Suboxone or buprenorphine daily, then all you do is now take that dose and divide it in half and take 4 milligrams twice a day. With 4 milligrams twice a day, about 60% of the opiate receptors are still open and available for regular opiate use. In other words, if you're taking 8 milligrams of Suboxone or less a day, just divide your dose in half. That frees up a lot of those receptors, and then physicians and anesthesiologists can give you pain control in the hospital using regular opiates. So the low dose of buprenorphine works well and works fine with regular opiates. If you're on higher than 8 milligrams a day, say you're on 16 or 24, the day before your procedure, divide up your dose into twice a day, and then the day of your procedure, just take 4 milligrams. What's going to happen is the hospital team will then keep you on 4 milligrams twice a day. That's about the amount where you can sort of stay on the buprenorphine. It works synergistically with regular pain meds. Okay, now if you go above that, you have less opiate receptors available for binding with full agonist opiates, okay? So really, it's a matter of kind of what your dose is now. If you're above 8, you're going to come down to basically 8 milligrams a day, and your pain's going to be augmented with regular opiate treatment like a regular patient would get. And in the post-operative period, the buprenorphine dose will start to go up. The regular opiates will start to go down. You won't have precipitated withdrawal because you're already on this low dose of buprenorphine that has enough binding to prevent that. So again, this is dealing with perioperative management. This comes up a lot for my patients who are worried about it. You know, they have a hip replacement planned or if something happens. So again, we don't stop the Suboxone, we don't stop the buprenorphine. Just divide the dose into about 8 milligrams a day or less and use regular opiates. This is becoming the standard of care now. Anesthesiologists now, surgeons now are more familiar with this. If you have any problems, questions, whatever, happy to take your questions, but I wanted to kind of give you that update. And this is, again, it's an evolving field, but that's the recommendations now. It seems to be working well with our patients. Okay, that's it for now. Thanks for listening. Please share this video. Please subscribe to our channel.